Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Tuberculosis is a disease caused by Mycobacterium tuberculosis and is transmitted from person to person through aerosol created when talking, coughing, and sneezing. Tuberculosis usually affects the lungs, but it can also affect other areas of the body, including the central nervous system. Tuberculosis is treatable and curable, but drug-resistant tuberculosis does occur. One type of drug-resistant TB is called multi-drug-resistant tuberculosis, and it is increasingly becoming a worldwide problem. In multi-drug-resistant TB, the tubercle bacilli are resistant to isoniazid and rifampin, the two drugs most commonly used to treat tuberculosis. There are several causes for the development of resistance to these antibiotics. Among these causes are patients not taking the antibiotics on a regular basis as prescribed, or patients not following the regimen through the full course of therapy. In some areas of the world, healthcare providers are prescribing inadequate or incorrect drug dosage, or drug administration is not being carried out for an adequate duration. In some parts of the world also, there are drugs of poor quality. Individuals with drug-resistant tuberculosis can transmit the resistant strain to others, just as with the transmission of non-resistant tuberculosis. In the United States in 2015, multi-drug-resistant TB occurred in approximately 1%, or 95 of the 9,500 patients newly infected with Mycobacterium tuberculosis. Globally, the incidence was higher, with about 3.5%, or 350,000 patients being drug-resistant. The greatest number of multi-drug-resistant cases is seen in China, India, and the Russian Federation. Of special note are 20% of patients with drug-resistant tuberculosis have multi-drug-resistant tuberculosis. This emphasizes the need for proper drug therapy for the proper duration and patient cooperation and compliance with the protocol. In addition to multi-drug-resistant tuberculosis, i.e. the organism resistant to rifampin and isoniazid, the other type of TB resistant is called extensive drug-resistant TB. This has now been reported in greater than 100 countries, including some few cases reported in the United States. The extensive drug-resistant organisms are resistant to isoniazid and rifampin, as in the multi-drug-resistant organisms, but in addition are resistant to any of the fluoroquinolones and at least one of the three injectable second-line drugs, that is amikacin, kanamycin, and capreomycin. Extensive drug-resistant tuberculosis has high prevalence in HIV-positive patients. This has been most recently studied in the Eastern Cape province of South Africa, where there is a high incidence of HIV and a high incidence of both multi-drug-resistant and extensive drug-resistant tuberculosis. I speak of this today because as the world gets smaller, we in the laboratory and in the healthcare setting must have awareness of the existence of these types of organisms and continuously be aware of the proper infection control precautions. In addition, as clinicians, we must be vigilant to the potential for cases of tuberculosis, and when tuberculosis is diagnosed, adhere to the treatment guidelines as set forth by the CDC in order to achieve optimal results. Thank you for your attention.